in 1 year, at a time of 1 year. And because we know that 50% of couples fail to achieve pregnancy within 1 year, and about 1 in 8 couples encounter problems when attempting to conceive a first child, and 1 out of 6 couples when attempting to conceive a subsequent child. There are 3% women remaining involuntary childless, while 6% various women are not able to have as many children as they would wish to. So these are the common facts, and infertility affects both men and women. And this is very interesting that female partners may compensate for the fertility problems of men. So infertility usually manifests if both partners have reduced fertility. So first of all, as a health professional, as a clinician, we always have to make sure that we have taken a good history and examination of both the partners. So this is a recommendation by EAU guidelines 23. Like every year, they have these strong recommendations. And it is also known that examine all men diagnosed with fertility problems, including men with abnormal semen parameters for urinary abnormalities. So this is important because you have always seen, I have seen multiple times that men are coming to our clinics and they are having repeated marriages, like third marriage or fourth marriage, and then somehow they were forced to do a semen analysis which turned out to be azoospermic. So that is the reason we have to examine everyone. So what are the diagnostic evaluation that we have? Clinical history examination we all do for multiple purposes, like genital examination, multiple level of obstruction we can have. There's semen analysis, which is the basic tool, hormonal levels like FSH, genetic testings, and testicular biopsies in the end. Ultrasound gives you a brief knowledge of the anatomical changes of the testicles and genitals. So what are the prognostic factors that you should look for in a person with infertility? The duration of infertility, like many people who come to you that have problems in second pregnancy, so they have a very short duration of issues, so you can cover them more easily rather than with a person who is having duration of infertility like many years. And we also know that primary or secondary infertility, like I already said, results of semen analysis, multiple factors that can be correctable, multiple factors that are fixed, that cannot be changed. There are age and fertility status of the female partners, and this is known from the studies that compared to a 25-year-old woman, fertility potential of a woman aged at 35 years is reduced to 50%. And then it is reduced to 25% in next 2 years, and it is less than 5 years at the age or over 40 years. So age really matters, and this is the part of semen analysis. I am sure in the first half we have discussed these parameters in detail, but I would like to mention few things that we always have in our clinics, and I get many referrals about these semen parameter issues. So this is the guideline recommendation for the semen parameters, lowest reference limits. As we know that the volume should be 1.4 to 1.5 ml, not less than that.